Namaskar. We have been talking about the Trio of Flatulence by Dr. Nash, and we have already covered the remedy China or Cinchona officinalis. And today we're going to do Carbo Veg as Dr. Nash talks about it, as Dr. Nash has written, and we'll be doing it from his materia medica. So, this trio of flatulence actually contains three remedies as it is a trio, obviously. So, it contains China, Carbo Veg, and Lycopodium. And you see, China and Carbo Veg, both of them, as Dr. Nash introduces Carbo Veg, he says that both of them have flatulence and debility. So, flatulence will be there, obviously, because this is a trio of flatulence basically. But there is also debility in both of them, very characteristically present. But now he says that Carbo Veg, whereas has this weakness which is not surpassed by any other remedy. So the weakness of Carbo Veg is so much that it cannot be compared to any other remedy. It is the most debilitated kind of situation in Carbo Veg. Okay. Next, he tells us that Carbo Veg, arsenic, and muriatic acid together they form a trio. Okay, Carbo Veg, arsenic, and muriatic acid together form a trio according to well-known indications, which have snatched many patients from the very jaws of death. So these remedies have snatched many people from the very jaws of death, meaning they have been indicated in very last, in the last stages of any kind of disease where the patient is almost going to die, and these remedies have brought him back, okay, restored his health. So that is what he's trying to tell us. So these three remedies are a trio for that. Okay, so that's about the very basic introduction. Now he goes on to tell us about the constitution of Carbo Veg, the picture, how he looks and how he appears to us. Okay, so the picture of Carbo Veg is such that the vital force of these patients is nearly exhausted. Okay, they have this cold surface, so all their body will be cold. Okay, especially from knees down to the feet, the body will be cold, and he lies motionless as if dead. So, since this is the last stage of the disease, he will lie motionless as if dead, and the breath is cold. Okay, this cold surface, the breath is cold, the pulse is intermittent and thready, and also there's cold sweat on limbs. So, the whole condition is as if the patient is going to die very soon. And hence, he says this is truly a desperate kind of condition, a desperate situation. Along with that, blood stagnates in capillaries, causing blueness, coldness, and ecchymosis. Okay, so I've tried to make it in a drawing or diagram. So there is ecchymosis that takes place, and this ecchymosis, so this is very common in Carbo Veg actually. Blueness, coldness, ecchymosis, stagnation of blood in capillaries. So that also comes under the picture, obviously. And then we see Dr. Nash tells us that the patient is so weak that he cannot even breathe. So he is so weak that he cannot even breathe, and he is constantly wants to just be fanned. So he constantly wants to be fanned, and he will gasp, "Fan me, fan me." Now this is what Dr. Nash says. So this is actually a very important point in Carbo Veg. Carbo Veg patient constantly wants to be fanned. Until now we saw that the patient has cold surface. Okay, and this cold surface, especially from the knees down to the feet, even the breath is cold, he is motionless, his pulse is steady. So the complete situation is as if he's going to die. And this is also very important. In the capillaries, you see, there is this stagnation of blood that takes place, and it will cause blueness, coldness, ecchymosis, and he wants to be constantly fanned. Now this is a picture of a case of typhoid fever actually, which is an acute infection, acute situation. Okay, now, since we are talking about a picture which is in the acute disease in typhoid, so let's see. He says that he tells us about another typhoid case while talking of it. So he says this typhoid case was of an old woman, and these symptoms were obviously present, the ones that we discussed just now. Along with that, there were hemorrhages. So in this remedy, there are hemorrhages as well present. Okay, so there's a lot of tendency to bleed. So hemorrhages, which are dark, decomposed, unclotted blood, is there, oozing from gums and nostrils. So the blood oozes, and this gives rise to indescribable paleness. So there is a lot of paleness in this remedy, not only Hippocratic face, okay, but also the skin of the whole body is pale. Okay, so there's indescribable kind of paleness, not only the face but also the whole skin is pale, the whole body is pale, and yet Carbo Veg restored to health this aged woman. So see, the condition was so bad. She had all these symptoms, meaning she had this cold surface, and she had the whole picture as if she's going to die. Along with that, there was stagnation of blood, ecchymosis. She wanted to be fanned. There were hemorrhages, and the hemorrhages were dark in color. So dark blood was coming out, decomposed blood was coming out, and the oozing was taking place from gums and nostrils. Okay, so from the gums and the nostrils, if there's blood coming out and there's whole this kind of situation, who would think that this person would live? Even the doctors give up, and they feel that no, this person is not going to, like, this person may die. So but here he says that Carbo is restored to health this aged woman. So this is the power of Carbo Veg. This is the magic that Carbo Veg can create. Okay, so now he tells us that now, since this was typhoid, right? We were talking about typhoid. This picture that he told us, which is of Carbo Veg. So it, even if the patient does not have typhoid, he has some other condition, this picture will exist. Okay, and if it exists, you have to give Carbo Veg. But he just gave an example of typhoid fever. Now he says that typhoid fever, which was an acute disease, but let's see, this remedy is not just for situations when the death is near, in acute situations, or in the later stages of acute situations, when the patient is extremely debilitated, okay, and near to death. But it is also used in some chronic conditions. So let's see what are those. So here he says that typhoid is an acute disease, but Dr. Nash says that the sphere of action of this remedy is not by any means limited to low or weakening states in connection with acute diseases only. Okay, but it can be used in chronic also. Now he also says that I have here, as faithfully as I can, portrayed the wonderful power of this remedy in such a desperate condition. So just now he has told us about a case of typhoid fever. So he says that he has tried to portray, or he has actually portrayed the wonderful power of this remedy. But of course, no remedy can raise the dead, no matter how strong the indications before death. But no remedy can come nearer than this. So he's saying that obviously, if the person is dead, you cannot give him any kind of remedy and then wake him up from death, or get him back from death. But this remedy is the remedy which comes most nearer. Okay, it comes the most nearer to death than any other remedy that we have. Okay, that is what he wants to say. Then he quotes Dr. Henry N. Guernsey for telling us about the chronic conditions in which Carbo Veg can be used. So Dr. Henry Guernsey explains that Carbo Veg is useful in those cases in which diseases seem to be engrafted upon the system by reason of the depressing influence of some prior derangement. So there was some prior derangement that happened. You got some kind of disease, and after that disease there has been some engraftment that has happened upon the skin system, meaning that there has been something else that has come up. So let's see examples and you will understand after that. So whooping cough in childhood. Okay, so this patient got whooping cough in childhood, after which he has asthma. So since he has got this whooping cough, which has got cured also, which went away, but since then he has got asthma. In the same way, there was a drunken debauch that had been done few years ago, and after that, since that drunken debauch, the patient has got dyspepsia. So in this kind of situation, you can give Carbo Veg to clear this up. Okay, it will help you. So that is what he wants to tell us. Next, he goes on to talk about a sphere of action of this remedy, very important sphere of action, which is GIT. So now he finally comes to the main thing, the GIT, because we're discussing the trio of flatulence. So GIT is obviously something that we need to discuss. But he has just in the start, talked about the whole general situation of Carbo Veg, the stage in which Carbo Veg is very well indicated. And after giving us a brief overview of the remedy, the general understanding of the remedy, we now come to the main sphere of action that we're talking about, when especially we're talking about Carbo Veg as one of the trios of flatulence. So in GIT we see, he says first of all that Carbo Veg affects the whole alimentary tract deeply. Okay, deeply. And this deeply word he literally means, and you'll know why. Okay, so the same weakened, broken down condition appears over here also. So even in the GIT, the same broken down, debilitated, weakened kind of condition will appear, just like we have seen just now. Okay, so the condition is completely as if the whole just like he uses this word very correctly, the whole thing is like he's broken down completely. Okay. So the GIT is also in the same way. You see, the gums will break down. So he starts from the mouth, and the gums that you have, so they will break down, they will become spongy. So you see the consistency of the gums will become spongy, and it will bleed on touching also or sucking them. So the gums will become very, will break down, will become spongy, and will bleed on even touching or sucking them. So they are so sensitive that even if you touch or suck, they will bleed, and they become retracted from the teeth. So that is not being drawn in the diagram, but they will like kind of retract from the teeth. Okay. And are painfully sensitive or sore. So they're very, very sore, they're very sensitive, and especially on chewing. So when you chew, there will be a lot of pain. Sensitivity will increase, and on even on pressing the teeth hard. So not just on chewing, but even if you press your teeth hard, that will also give rise to this kind of bleeding or pain. So the situation of the gums is very bad. They are in a very degenerated kind of a state. There's a lot of gingivitis. Actually, there's a lot of, they will become spongy, they'll bleed. Okay, so that situation exists in Carbo Veg in GIT. You see the gums in the start. Then we go on to talk about the stomach. That is what Dr. Nash does actually. So in the stomach, he tells us that the stomach is also weakened. So you see, this is actually a word for Carbo Veg, and that is why in the very start of Carbo Veg, Dr. Nash, the first thing that he tells is that even if China and Carbo Veg both have debility, Carbo Veg has a debility or weakness which does not match any other remedy, which cannot be surpassed by any other remedy, because the whole situation, every organ is weak. So see, you see the gums are weak, the stomach is weak, and the situation, the picture which we saw just now was also completely a debilitated state. The stomach is weakened, there's frequent acidity and pyrosis. Plainest food will disagree. So whatever plain food he tries to have will not agree. He'll have some complaint or other. Even if he has a very simple khichdi, even if he has very simple kind of food, okay, and fat food especially. So obviously fat food will disagree even other remedies, okay, even any remedy who has action on like stomach causing acidity or indigestion, they all have problems from fat food, because fat food is anyway difficult to digest. But over here, even the plainest food is aggravating the patient, so fat food obviously will. And here Carbo Veg succeeds when pulsatilla fails. So now he gives us a tip. So if you are giving pulsatilla to your patient, because the whole symptom picture is maybe matching pulsatilla for acidity, for indigestion, for stomach related issues, and pulsatilla fails, then you can give Carbo Veg also. Obviously, the symptoms should agree. Most marked and valuable place for Carbo Veg. Now he tells us that the most marked is its power to relieve complaints from excessive flatulence in the stomach. So not in the abdomen, he's saying, okay, he's first of all saying that if there's excessive flatulence in the stomach, then its power to relieve the complaint is like unmatched for Carbo Veg. It's very, very valuable. It's very, very marked. And it can cure simple dyspepsia to stomach cancer if symptoms are present. So going to talk about those symptoms, and if those symptoms are present in your patient, that patient might be coming to you just for simple dyspepsia, or he might even come to you for the gravest disease like cancer of stomach, but he will get better if the symptoms agree. Let's see what are the symptoms, and do not forget that excessive flatulence in the stomach has been talked about. Okay. So he gives us the symptoms here. So there's great accumulation of flatulence in the stomach. The stomach feels kind of full and tense from flatulence. So there's so much flatulence that the stomach feels full and tense. And flatulence is generated also in the abdomen. Now he says that first we've talked about the flatulence being created in the stomach in Carbo Veg, but now he says that flatulence is also generated in abdomen, but in Carbo Veg cases, it is most troublesome in the upper part, that is in the stomach part. Okay, so it is most troublesome in the upper part, and not in the other issue, pelvic or the hypochondriac parts of the abdomen, but more in the upper part. Okay, and there's great pain in stomach on account of flatulence, which is aggravated by lying down. So this is also a symptom. This aggravation from lying down, and burning in the stomach may also be present. Okay, so there's burning in the stomach, there's aggravation from lying down, the pain which is there is aggravated from lying down, there's a lot of flatulence, especially in the upper part of the abdomen, and the stomach feels full and tense because of it. Okay, these are the symptoms. Next, we move on to talk about the respiratory symptoms of Carbo Veg. So Carbo Veg also has a good action on the respiratory system, and he says that over here that beginning with the larynx, it causes and cures great hoarseness. So have you thought of Carbo Veg for hoarseness of voice? If not, then from today onwards we can think, because Dr. Nash has said this. Okay, so this beginning with the larynx, he says in the respiratory system there is a lot of hoarseness in this remedy, which is characteristically worse in damp air, especially of evening. So if you have rainy season going on in your country and patient comes to you and tells you that my voice gets hoarse, especially in the evening, then the remedy that you have to give is Carbo Veg. Then he says now, he gives us one more remedy. So he says now, if it is damp weather, so again, if it's rainy season going on, but the voice is hoarse, especially in the morning, unlike in Carbo Veg, which was especially in the evening, then the remedy is causticum. So if it's in morning, then causticum. If it's in evening, then Carbo Veg. In rainy season or damp air, okay? So that is what he tells us about the larynx related part, the hoarseness related part. Okay. Next, he moves on to tell us more about the respiratory system. So here he tells us that this is also a great remedy for bronchitis and asthma of old people, especially. So of old people, okay, of broken down constitution. So these old people are having this kind of a constitution that we've just talked about, broken down constitution, venous system predominating, meaning there's blood stasis, ecchymosis, and in very desperate cases where the patient appears as if dying. So desperate cases is something that you have to think of Carbo Veg for. So burning is from glowing coal in the chest. So there's burning, like there's glowing coal in the chest. So can you imagine that kind of burning? And there are also other remedies like phosphoric acid, stannum, and sulfur for the same symptom that we have to differentiate. Okay, phosphoric acid, stannum, sulfur for the same system which is burning as from glowing coal in the chest. Then he says that it is also used in desperate cases of pneumonia. Okay, especially after antimtat. So especially if if you have given antimtat and antimtat has also failed, antimtat is something that we do give in pneumonia in later stages, and if it has also failed, then to assist the patient to clear his lungs of the great quantities of loosened mucus. So the mucus is also loosened, but it is not able to come out. It is in great quantity, and then that even after giving antimtat, if it's not helping, then you can give Carbo Veg, and it will help clear his lungs of the great quantities of loosened mucus when cyanosis and paralysis threaten from weakness. Okay, so there's so much weakness that you feel that the patient might go in, like patient is near to paralysis, and there's cyanosis also, a lot of cyanosis, because there's obviously not the breathing is not so normal. Okay, because of the great quantities of mucus or in the lungs. So if this its sputa then is apt to be fetid. So the sputa or the expectoration then is going to be fetid with cold sweat and breath, which we've already discussed. So this remedy has cold sweat and breath, and the characteristic wanted to be fan condition. This is very, very characteristic. This is the keynote for Carbo Veg. So there's wanted to be fan condition, along with that cold sweat and breath is there, and the expectoration is fetid. Even after the antimtat state, you can give Carbo Veg. Okay, next he talks about a few miscellaneous points, and then we're done with Carbo Veg. It is a very beautiful yet short discussion. So now he says that Carbo Veg hemorrhages may occur from lungs, nose, stomach, bowels, bladder, or any mucous membrane. So from anywhere hemorrhages can occur in Carbo Veg, because anywhere it has a hemorrhagic tendency. No remedy can take its place in broken down, greatly debilitated constitution where the surface from which the blood oozes seems too weak and spongy to hold blood in them. So just like we talked about the gums, okay, they were also very spongy, and it was difficult for them to hold blood inside, and they were oozing blood. Okay, so blood oozes from that surface. So that is what they're talking about, Dr. Nash is talking about actually. So that situation, whenever it is there, you have to think of Carbo Veg. The patient's face and skin is very pale, so not only the face but also the skin is pale even before the hemorrhage. Now see, this is characteristic, even before the hemorrhage has occurred. This is characteristic, right? So after hemorrhage, after blood loss, obviously there's going to be pale skin. But now he says that even before any kind of bleeding happens, the paleness is there. He says that China and Carbo Veg are decidedly complementary. So they're complementary. Okay. So now let's just revise very fast, very quickly. So while talking about the remedy Carbo Veg, which comes under the Trio Of Flatulence along with China and Lycopodium, we've seen that Dr. Nash starts by telling us that China and Carbo Veg both have flatulence and debility, right? But he tells us that the debility that Carbo Veg has, okay, this China and Carbo Veg, both of them have this, but the debility that Carbo Veg has cannot be surpassed by any other remedy. Not surpassed by any other remedy, right? And that is why the debility you can anyway, we've seen Carbo Veg, right? Now we've talked about Carbo Veg, so we saw that debility is there in every sense in this remedy, okay? Then he tells us that Carbo Veg along with arsenic and muriatic acid form a trio which which has snatched many patients from the very jaws of death. Then he goes on to tell us about the picture of Carbo Veg, the whole picture of Carbo Veg, where he tells us that the vital force of the patient is completely exhausted, and the patient, has cold surface, right? There's cold surface, especially from the knees to the feet, right? From the knees to the feet, and there's cold sweat also, which is also especially on the limbs. There's cold breath also, and we saw that the pulse is thready and intermittent, right? And we've seen that he lies motionless as if he was just dead, right? The patient lies motionless as if he was dead. So that's there. Plus there was this blood situation, okay? So there's this blood situation of ecchymosis, right? So there's ecchymosis, there's stagnation of blood in the capillaries, right? And there's this blueness, coldness, right? Then we saw that a very important characteristic which is present is the patient will say, fan me. So he wants constantly to be fanned. And this is kind of picture that also exists when the patient gets typhoid fever. So because of that, he also discusses a case of typhoid with us, and where he tells us that all these symptoms were present. Along with that, there was also hemorrhages, right? There was bleeding, especially from gums and nostrils, right? And it was dark blood. So dark blood was there, and this bleeding gave rise to indescribable paleness. And in such a situation, the patient got Carbo Veg, which the patient was actually a very old lady, and she got Carbo Veg and she completely restored with it. Then he tells us that there's this typhoid is an acute situation, but the same thing can also, this remedy is also used in chronic situations when there is especially a prior derangement has happened. Like sorinum also is used in such conditions, like there's prior derangement, like the patient might have had whooping cough earlier, and after whooping cough got better, he got asthma, and since that whooping cough episode, asthma has been always there. Okay, in the same way, the patient had had an episode of drunken debauch he had done a few years ago, and after that he got dyspepsia, which still remains. Okay, since that drunken debauch, he has got this dyspepsia, which hasn't went away until now. So even if it has been many years to that episode now, so that was there. Okay, that was what Dr. H. and Guernsey had explained to us. Now we talked about the GIT related symptoms, which are very 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 important in this remedy, because we're talking about the Trio Of Flatulence especially. So in this GIT symptoms, we saw that this patient has the whole alimentary canal is deeply affected, and this word is very important because the whole situation is as if weakened and broken down, even in the even in the GIT, right? And we saw that the gums were such that they were broken down, they become spongy, they bleed on, even if you touch them they bleed, even if you suck them they bleed, they get they're retracted, and they're very very sensitive, especially when you keep the teeth even on each other, or and hard press them hard, or even if you chew, so that is going to hurt you. Okay, that's the situation. And in the stomach, we saw that there's a lot of flatulence, especially in the upper part in the stomach. There's frequent acidity, even the plainest food will disagree. Okay, and we saw that that any kind of these symptoms present, even simple dyspepsia to cancer of stomach can get cured. A lot of flatulence is there, right? We have seen that a lot of flatulence is there, and that flatulence is especially in the upper part, as we've seen in Carbo Veg, right? And we've seen that there's this pain in stomach which is aggravated on lying down, right? And we've seen that there's also some burning that is felt in the stomach, right? There's burning that is felt. Then we went on to talk about the respiratory system, in which we saw we first of all talked about the larynx, and there's hoarseness that this remedy causes, and this hoarseness is especially in damp weather in the evening, right? And if there's damp weather and there's affection, the voice is getting affected in morning, then the remedy is causticum, right? Then we talked about more about respiratory system, in which we talked about bronchitis or asthma, especially in old people, right? And we also saw that there's burning, this is very important, there's burning as of from glowing coal in the chest, right? That we saw. Then there's a desperate situation of, we saw pneumonia, and in pneumonia the situation is such that even after even antidote is not helping, so you can give Carbo Veg, it'll bring out large quantities of this mucus and help your patient get better. Even that situation will be present, like the expectoration will be very bad, fetid, offensive, and cold sweat will be there, and he wants to be fanned, right? Then talked about the thing that they will be very very pale even before even before hemorrhage has taken place, right? And China and Carbo Veg are complementary. So we've already discussed China, and this was about Carbo Veg, and we've done even revising Carbo Veg now. So that's all about Carbo Veg, as Dr. Nash tells us. And the next remedy we're going to talk about is lycopodium, and there's this differentiation between these three remedies that has been done by Dr. Nash under the remedy lycopodium, and we'll discuss that also in the next video on lycopodium. I hope you enjoyed this video. We have more such videos by Dr. Nash in the playlist that has been created for conveniently being able to choose among them. So that's there. Okay, thank you.